obviously there's an increase in the number of suicides, and we're very, very concerned again. What happens is when there's a suicide the next morning, I get a call from Dr. Yocum, and when they tell me he's on the line, I don't want to take the call because I have a good idea why he's calling. And you can see there was one spike in 2008, which seems to be an anomaly, but if you look where we are now, currently we're at 15 for the current calendar year. That was equal to the total of the entire 2012, and you can see we seem to be going up one a year for the past 4 years. But I think it's probably important to note, if you look 10 years ago, we were in the range of 7 or 8, so it's over that period of time it's pretty much doubled. That's a great cause for us to take a closer look at this, to address the issue. And as Dr. Yocum will probably point out, I believe there was one week where we had 3 in a week.
I had 4 in 20 days in July and 4 in 14 days in September. So when they're coming in bunches. And
there clearly is a population that strikes us. It certainly is men in the ranges of 30s to primarily 60s, primarily using firearms as a means to complete the suicide. Surprisingly, we did have 2 females, or 3 females, I believe, this year.
2.
Two. I have 3 in my report.
3 years, you're right, sorry.
3,
yeah.
Which is unusual for us as well. But the core of this group is the what I'll call loosely middle-aged men. You can see there's some issues of unemployment and depression that are involved in many of these cases. We wish to emphasize that there are resources available for individuals who may be contemplating suicide, or for families or friends who feel that someone they know or someone in their family is at risk for suicide. Please wait. There's always a tomorrow, and crisis intervention is a phone call away, 274-3363. We urge people to take advantage of the resources that are available to them.
Well, we do have a very active, and have had a very active, suicide prevention task force here in the county for many years. We do have a name for it. It's called TIPS, Training and Information for the Prevention of Suicide. Through several different grant funding opportunities, we've been able to create some community things, so you may have seen them around the community. We have 2 different flyers that have been hung up in many different areas around the community. They do have the little tear-off tabs at the bottom that have crisis interventions number. Again, very important for everyone to know that there are options and there are resources available to help folks with whatever they're dealing with in their lives. We've also created business cards that have some great resources on them. On the front are the resources and the numbers to call, and then on the back are the warning signs of suicide. So really being able to help those who may not be familiar with some of the warning signs, but then also that person who may be contemplating as well, so that again they're looking at what resources and who they can call to obtain the help that they need. Our task force has several different subcommittees, one for children and adolescents, then we have an adult subcommittee, and then most recently we've added a media campaign subcommittee, really feeling that it's important for us to focus our efforts on how we can really, through media, reach the individuals that we're not currently reaching that are completing suicide. In an effort to do that, we have one other grant that came through from the Office of Mental Health and Substance Abuse Services, and it's for mental health first aid training. It will be conducted 2 times here in the county. The first will be in November. It's November 18 and 19, both days from 9 o'clock to 4 o'clock p.m. at our office, Lebanon County MHIDEI. And it will be completed by Community Services Group as the provider. just a little bit about mental health first aid. I'll read you here. Like CPR training helps a non-medical professional assist an individual following a heart attack, mental health first aid helps an individual who doesn't have clinical training assist someone experiencing a mental health crisis. In both situations, the goal is to help support an individual until appropriate professional help arrives. So it's really about informing those about things to look for and how to get the help until those professionals arrive. We'll be marketing this to, again, non-professionals in the community. So we have a long list of places that the flyers will be going, and we'll be speaking to folks around the community. Just so you know, we'll be going to places like the YMCA, churches, Jubilee Ministries, Career Link. We want them at the libraries. Salvation Army, we're talking about taking them out to even bars and restaurants in the area. We're really trying, again, to put them in places where those adult males would be going and maybe reach the folks that are working in those areas that have contact with them and would be able to see the signs and really get them the help that they need before taking action such as suicide.
This year, out of these 15, 8 of these males were never married. So here again, they don't have a support system.
Yeah, absolutely.
So that's why we're trying to, by compiling this data, we can target the people that seem to be, taking their lives, which we never had before we got the computer system. I could never do that. So when we enter all this in, when the deputies and myself are out in the cases, this is stuff we're looking for to enter into the data bank. Just to say, out of all the cases, obviously the coroner's office doesn't deal with nice cases, but these are probably the most traumatic for deputies, for myself, for families. There's, anybody who dies, that was traumatic, but suicides, they leave behind families who will never have any answers for why they did what they did. And those families live with that the rest of their lives, knowing, could I have done something? I should have seen the signs. And hopefully through this, they're going to see some of these signs and maybe we can prevent some of these cases.
That's a perfect segue to my question, Doctor. I know that you mentioned that you have that card with some tips on the back. Would you kindly review that so that people will know what those tips are?
Sure. There's actually quite a few warning signs of suicide, so I'll just read down through them. Threatening to hurt or kill self, looking for ways to kill self, seeking access to pills, guns, or other means to harm self, talking or writing about death, dying, or suicide, feeling hopeless, experiencing rage, uncontrolled anger, or seeking revenge, acting reckless or engaging in risky activities, feeling trapped, like there's no way out, increasing alcohol or drug use, withdrawing from friends or family, having dramatic changes in mood, feeling like there's no reason for living or no sense of purpose in life, sleeping too much or too little. So there's quite a lot on that. And typically it's not just one particular thing. You will see several of those, and they might be, kind of things that in and of themselves may not be as much, but when you're seeing several different things combined, it's a great concern.
Do you see evidence that people have clearly thought this out and planned for it?
This year, really, we've seen very few notes. I don't know if that's a trend, but here again, that's notes at least help the family know why they did it. They don't leave notes now, so we have no idea why.
You have statistics here going back over a decade, which is also the period of time for a census to be taken. So of note would be that with an increase in population, there may be a slight increase in this statistic, but maybe only by 1. So it's in excess of that. I think that your concern is definitely valid.
Say there's no such thing as a bad day. Some days just aren't as good as others, And I wish some people think about that. There's always tomorrow.
It's a shame that we can't just pass that off to other folks.